Understanding Thought Lack Hyperactivity Issue, ADHD. A comprehensive associate thoughts on the hyperactivity issue, ADHD, is a neurodevelopmental issue that impacts countless young people and adults all over the planet. Despite its inescapability, ADHD remains extensively misconstrued, much of the time pardoned as straightforward languor, non-appearance of discipline, or a phase that youths will outgrow. In any case, ADHD is a veritable state of mind that requires sorting out, support, and reasonable treatment. This article aims to give a total diagram of ADHD, its causes, secondary effects, assurance, treatment, and the meaning of care in empowering a more far-reaching and consistent society. What is ADHD? ADHD is an ongoing condition described by constant examples of mindlessness, hyperactivity, and impulsivity that disrupt everyday work and improvement. It is one of the most widely recognized neurodevelopmental messes, with side effects ordinarily showing up in youth and frequently going on into adulthood. While ADHD is most usually analyzed in youngsters, progressively perceived as a condition, it influences grown-ups too. The issue appears in three essential sorts. 1. Inattentive sort. People with this kind of ADHD battle with concentration, association, and finishing responsibilities. They might seem absent-minded, quickly drawn off track, and unfit to adhere to through on guidelines or obligations. 2. Hyperactive imprudent sort. This type is set apart by unreasonable energy, impulsivity, and trouble standing by. People might hinder others, act without thinking, and have trouble holding up. 3. Combined sort. As the name suggests, this type includes side effects of both carelessness and hyperactivity impulsivity. It is the most considered normal type of ADHD. Reasons for ADHD. The specific cause of ADHD isn't completely understood. However, research suggests that it results from a blend of hereditary, natural, and neurological factors. A portion of the key givers includes hereditary qualities. ADHD will, in general, split families, showing major areas of strength in a part. Studies have recognized a few qualities related to the problem, which influence mental health and synapse capability. Mind construction and capability. Neuroimaging studies have shown that people with ADHD frequently have contrasts in the design and action of specific cerebrum districts, especially those engaged with consideration, motivation control, and leader working. Natural variables. Openness to ecological poisons like lead during youth might expand the gamble of creating ADHD. Also, maternal smoking, liquor use, or medication use during pregnancy can add to the improvement of the problem. Untimely birth and low birth weight. Youngsters conceived rashly or with low birth weight are at a higher gamble of creating ADHD. Pre-birth and perinatal complexities. Entanglements during pregnancy or conveyance, like oxygen hardship, can likewise assume a part in the improvement of ADHD. Side effects of ADHD. The side effects of ADHD fluctuate continent upon the seriousness of the problem. Be that as it may, a few normal side effects include negligence, trouble supporting consideration, successive reckless missteps, inconvenience putting together assignments, neglect, and being quickly drawn off track. Hyperactivity, unnecessary squirming, fretfulness, trouble remaining situated, and a steady need to move or go around. Impulsivity, acting automatically, intruding on others, trouble sitting tight for one's turn, and going with rushed choices. Close to home dysregulation, trouble dealing with feelings, prompting continuous emotional episodes, dissatisfaction, and crabbiness. Scholastic and social difficulties, battles with homework, trouble adhering to guidelines, and moves in keeping up with kinships because of rash or problematic ways of behaving. It is critical to take note that these side effects can differ generally among people and may change over the long run. For instance, hyperactivity might diminish in adulthood, while obliviousness and impulsivity might persevere. Diagnosing ADHD. Diagnosing ADHD is a complicated interaction that requires careful assessment by a certified medical services professional, like a clinician, specialist, or pediatrician. The analytic cycle normally includes clinical meetings, social affair, point-by-point information about the singular's way of behaving, improvement, and clinical history from guardians, instructors, and the actual singular. Behavioral evaluations, utilizing standardized polls and rating scales to assess the frequency and severity of ADHD symptoms. Observation, noticing the singular's conduct in various settings, for example, at home, school, or during clinical visits. Rule out different circumstances, guaranteeing that the side effects are not worsened by another condition like uneasiness, sorrow, or learning incapacities. The determination of ADHD depends on the models illustrated in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, which requires the presence of no less than 6 side effects of distractedness, and additionally hyperactivity, impulsivity for youngsters, and 5 for grown-ups, going on for around a half year, and causing huge weakness in everyday working. While there is no solution for ADHD, strong treatment can generally foster incidental effects and help individuals with driving valuable and fulfilling lives. Treatment routinely incorporates a mix of social treatment, medication, and ways of life changes. 1. Social treatment. Lead treatment is a large part of the time the essential line of treatment for youngsters with ADHD. It is based on assisting individuals with systems to manage their secondary effects, work on progressive capacities, and cultivate positive approaches to acting. Parent planning and school-based mediations are, in a manner, critical pieces of social treatment. Number 2, drug. Catalyst medications like methylphenidate, Ritalin, and amphetamines, Adderall, are ordinarily prescribed to supervise ADHD incidental effects. These medications work by increasing the degrees of explicit neurotransmitters in the frontal cortex, further creating thought and diminishing impulsivity and hyperactivity. Non-stimulant drugs, for instance, atomoxetine, Strattera, and guanfacine, Intune, may likewise be used, particularly for individuals who don't respond well to stimulants. Number 3, way of life changes. Taking on a sound lifestyle can enhance various drugs and work on overall flourishing. Typical genuine movement, a respectable eating routine, palatable rest, and stress management strategies can all help with diminishing ADHD secondary effects. 4. Educational help. Youngsters with ADHD frequently benefit from individualized training plans, IEPs, or 504 plans, which give facilities and backing in the school setting. This might require additional time for tests, particular seating, or breaks during class. 5. Counseling and care groups. Directing can assist people with ADHD and their families in adapting to the difficulties of the problem. Support bunches give a place of refuge to share encounters, gain bits of knowledge, and get consolation from others confronting comparable battles. The significance of ADHD mindfulness. Notwithstanding the developing acknowledgement of ADHD, there is as yet a critical absence of mindfulness and figuring out in many areas of the planet. This absence of mindfulness can prompt shame, misdiagnosis, and insufficient help for people with ADHD. ADHD Mindfulness Month, celebrated each October, plays an essential part in teaching the general population, reducing shame, and advancing early finding and mediation. Bringing issues to light about ADHD is fundamental because of multiple factors. Early intercession, early finding and treatment can further develop results for people with ADHD. Mindfulness crusades help guardians, instructors, and medical care suppliers recognize the indications of ADHD and look for suitable assistance. Diminishing shame. Confusions about ADHD can prompt disgrace and separation. By expanding mindfulness, we can cultivate a more comprehensive and stronger climate for people with ADHD. Engaging people. Understanding ADHD enables people to look for help, advocate for themselves, and foster techniques to deal with their side effects. Supporting families. Groups of people with ADHD frequently face novel difficulties. Mindfulness drives to give assets, backing, and direction to assist families with exploring these difficulties. Examples of overcoming adversity. Living great with ADHD. In spite of the misinterpretation that people with ADHD can't have effective existences, many individuals with the issue have made striking progress in different fields. These examples of overcoming adversity act as a demonstration of the strength and capability of people with ADHD. Jim Carrey, the esteemed prankster and performer, have straightforwardly discussed his fights with ADHD and how he coordinated his energy and imaginativeness into his work. Emma Watson, the performer and lobbyist, have spoken about her experiences with ADHD and how she has managed her secondary effects while pursuing her tutoring and livelihood. Michael Jordan, the ball legend, has credited his ADHD for his tenacious drive and assurance, which pushed him to significance on the court. Charge Entryways, the fellow benefactor of Microsoft, has recognized his ADHD and how he has utilized his extraordinary point of view and critical thinking abilities to change the tech business. These models feature the significance of perceiving and supporting the qualities of people with ADHD, instead of zeroing in exclusively on their difficulties. ADHD is an intricate and complex problem that requires a complete way of dealing with finding, treatment, and backing. By expanding mindfulness and comprehension of ADHD, we can make a more comprehensive and strong society that engages people with ADHD to arrive at their maximum potential. Whether you are a parent, educator, medical services supplier, or somebody living with ADHD, it is critical to recall that with the right direction, backing, and therapy,